So I'm Minahil. I'm from Pakistan. I am currently an intern at Duke Global Health Innovation Center and doing my master's at Duke University. So I'm here with Cynthia today from Jacaranda Health. Jacaranda Health's mission is to provide better health outcomes for moms and babies across Kenya and beyond. And Jacaranda Health provides scalable and affordable health solutions through government hospitals for mothers and underserved babies by partnering with governments. So, Cynthia, how is Jacaranda Health changing the status quo in healthcare and maternal neonatal health space?
We pride ourselves in being disruptive, but we really look at how Jacaranda Health designs and deploys our low-cost innovations that can be sustainably integrated and scaled within resource-constrained national health systems. And we do this we build our ownership and ensure the sustainability of these solutions by co-designing them with our government partners. Our solutions are deployed in tandem, as mentioned, and really it's looking at the reduction of maternal and neonatal morbidity and mortality at our partner facilities, where we've been able to see a 31% reduction in reported rates of postpartum hemorrhaging, which is excessive bleeding during delivery, and also a 27% reduction in reported rates of neonatal deaths at our partner facilities. So our two main programs, one of them is actually Prompts, which is an AI-enabled SMS messaging platform that empowers women with free information and improves health-seeking behavior at critical moments. It combines a sequence of gestation-specific nudge messages, which influence key behaviors linked with better outcomes, such as ANC and PNC visit attendance, where we've seen a 27% increase in our fourth ANC attendance in moms on our platform. We've also been able to see an uptake in postpartum family planning. We also provide information on exclusive breastfeeding and nutrition amongst various other topics, all leading to better health outcomes for both moms and babies. What is also unique about Prompts is we have a two-way clinical help desk, which responds to moms' questions about pregnancy and postpartum and referring urgent cases to care. We also have what we call the voice of the mom. This is where we collect and analyze data from moms on their experiences of quality of care provided in facilities during their ANC and PNC visits, as well as deliveries. We then feed this back to help facilities and providers, empowering them to improve on their quality of services. Our second program is our EMONC program, which is our low-cost mentorship program designed to build and sustain life-saving obstetric skills amongst frontline providers. And for this, we partner with counties and deploy with counties and public hospitals to deploy EMONC mentorship to sustainably improving skills for providers at the facility. And it's really a training of the trainers program, where our Jacaranda mentors, champions, train government in-facility mentors who are empowered to continue mentorship support at the facility. And we've been able to actually see a 50% increase in neonatal resuscitation skills amongst the mentees we've trained. And another unique thing that we focus on for this program is making sure that the training takes place in the facility to ensure providers continue to improve their skills as they deliver services, but really also meeting them where they are. A project that we worked on last year, especially during COVID, in-person trainings were limited due to the COVID restrictions. So we saw an opportunity to innovate in the learning space. We launched our Delta platform, which is adapting modules from our existing curriculum to a virtual format, meaning providers could access vital scenarios and case-based learning from anywhere at any time. This is really a free service accessible through WhatsApp, It's self-paced, interactive, and supports continuous learning. And it's also linked to CPD points through an accredited curriculum, which is supported by the Nursing Council of Kenya. We're also able to generate actionable data from this platform, which is also helped to use, which also supports our health system managers, where we offer real-time insights on gaps in provider knowledge and skill sets, as well as track increasing provider competence at the county and facility level. Thanks, Manahil.
So how has Jacaranda Health evolved over the last 10 years?
And yes, our journey started in 2011, where we actually started as a social enterprise called Jacaranda Maternity. We focused on direct service delivery to provide high quality and low cost and respectful care to moms in parts of Nairobi. And in 2016, we realized from building solutions for hospitals, like appointment reminders for moms, FP messages, etc., that they could be both relevant for and scaled within public institutions to drive bigger and more sustained impact. So our nonprofit Jacaranda Health was born with the primary goal of partnering with national and county governments to improve outcomes in public hospitals, where we found 80% of Kenyan women deliver their babies, and where we saw the greatest opportunity for scale and impact. And since 2016, we've grown from 3 facilities in a single county to over 1,000 facilities across 20 of Kenya's counties, reaching 1 million moms to date.
What do you and Jacaranda Health hope to achieve in maternal neonatal health space?
So when we were entering this space, we found that 90% of maternal deaths at hospitals were preventable. And this is in Kenya, where our main operations are. And Jacaranda's vision is a world where all mothers experience childbirth safely and with respect, and all newborns get a safe start in life. We began by digging into the 90% and found some of the different challenges that were driving maternal deaths in Kenya. We found that 33% of maternal deaths were caused by delays in care-seeking behavior, where many expectant and new mothers were lacking access to adequate, clinically accurate information to seek care at the right time and place. We also found that 55% of maternal deaths occurred through provider-related challenges, where many providers do not feel empowered with life-saving skills or the ability to engage their clients more effectively to save lives. And so we also found that 80% of deliveries were taking place in public facilities. And this really led to our mission, which is to partner with governments to deploy affordable and scalable solutions through public hospitals, where the majority of underserved mothers and babies receive care, and in doing so, have a sustained impact on maternal and newborn health outcomes. And this is really why our 2 main programs focus on behavioral change for moms by empowering them to seek care at the right time and place, as well as improving the number of skilled delivery birth attendants.
Cynthia, what are the few challenges that Jacaranda Health have faced as it has grown?
One of our biggest challenges is sustainably scaling our solutions in a cost-efficient way. Prompts is always free for moms and should remain so, and must maintain a low unit cost so that it can be adopted and scaled by our government partners. This means a lot of work with national telcos to zero rate the cost of bulk SMS, as well as working directly with our government partners to help them plan and find budgets within their annual work plans to sustainably cost share these solutions. Another challenge has been integrating our solutions within the wider health system. When we deploy prompts and our eMonk mentorship programs in tandem, we're working to address the 2 main factors leading to poor quality of care, which is delays in health-seeking behavior and low provider competencies in emergency care. So through this, we've also acknowledged that to offer moms a true end-to-end maternal support requires looking at the gaps. For example, how do they travel to facilities after they've been referred by prompts? How will they pay for that travel and the care that they receive at the facility? Various different factors. This is why we've partnered with some great private sector players such as Rescue and ThinkWell to ensure that existing health system structures are all working in unison and not in silo, in order to ensure that moms are receiving high quality care in a financially viable way.
Thank you, Cynthia. So, what is your goal for both Jacaranda Health and your role in Jacaranda Health over the next 5 to 10 years?
So, most NGO projects or funded projects end after the funding is complete. So, how is it that we make this sustainable for national and county governments to continue having an impact on maternal and neonatal outcomes even after the end of the funded project? My role as country director will be to reinforce and build on the great partnerships we already have with national and county level governments, as well as a roster of new private sector partners that will help the improvement of cost sharing, that will ultimately advance the scale and sustainability of our solutions as a national standard of care.
Best of luck for your goals, Cynthia.
Thanks.
So, what projects are you currently working on?
There's quite a few of them, but I'll share a few. I'll share a couple. Right now, we're focused on building and strengthening our public and private partnerships to advance national scale up, as mentioned before. So we're growing our county partnerships. We're expanding our private sector partnerships with some ambitious organizations, as I mentioned, Rescue and ThinkWell. And we're deepening partnerships with local telcos to keep prompts affordable. From a technology standpoint, this really means our tech team is rapidly building out our AI capacity on prompts to reach more moms more quickly and with more accuracy, all meaning that they get to life-saving care when they need it. From a tech perspective, we're also exploring avenues to reach moms at the last mile. This includes, expanding our machine learning powering prompts to read and respond to moms in local dialects, empowering community health workers to enroll moms and reinforce prompts messaging, as well as interactive voice recognition for moms who might not be able to read but would still benefit from our services. So these are just a few of some of the projects we're working on.
You guys are doing some amazing projects, I must say. So
Thanks.
Cynthia, on a more personal level, when you're not working, what do you enjoy doing for fun the most?
Well, my friends and I have formed a hiking group. So we do at least hiking once a month in various places, and it can be anything from climbing a mountain, climbing a hill, to doing a coffee tour in the outskirts of Nairobi. I also enjoy my beach holidays, which I try to take as regularly as possible. And also that's where I really catch up on my reading. And I spend a lot of time also with family. I come from a big family, so there's always a birthday or a function or something.
That's really nice. So Cynthia, what tips do you have for others who want to grow in the maternal neonatal health space?
Wow. So I think always the first step is to understand your customer or client, which is in this case, the mom, the baby, and the existing health system, and focusing on the journey and that they're going on and ensuring to provide an end-to-end solution. A second part would really be looking at public and private partnerships to make it sustainable. And this is really so that you can have a real impact, focusing on engaging partners and building a sustainable model. The third thing is really looking around innovation, which people tend to think is building a fancy tool or product, but it's really looking at being smart in utilizing, creating, and adapting tools to suit your primary audience, which in this case is moms and babies, and reaching them where they are in order to ensure there is a real impact.
Thank you, Cynthia. Jacaranda Health is doing some super amazing work, and best of luck for future endeavors. Thank you so much for being with us today and talking to us and giving us your time. And yeah.
Thanks, Manahil. It's been a pleasure.